with my bell. Can you breathe in for me and then exhale and hold your breath? All right, and breathe, and again. All right, no signs of whooshing or swishing, which means there's no bruise present. I'm going to move on to your heart. I'm going to check the aortic area at the second intercostal space to the right of the sternum. Okay. And the pulmonic to the left of the sternum, second intercostal space. S2 is louder up here. I'm going to check the herbs to the left sternal border at the third intercostal space. All right, can you just place your breast for me? And the tricuspid at about the fourth or fifth intercostal space left of the sternum. And the mitral, which is mid-clavicular line at about the fifth or sixth intercostal space. S1 is heard louder down here, and I would stay here for 60 seconds and listen for the apical pulse. Then I would go back up with my bell in the same way I came down. No signs of abnormal murmurs, no S3 or S4 sounds, so that's good. Now I'm going to listen to your lungs. Every time my stethoscope touches you, can you take a breath for me?
Yep.
All right, I'm going to start at the first intercostal space. Okay. All right. All right. No adventitious wheezing or crackling on the front. Now I'm just going to check the back. Can you turn a little bit for me? I see you have 2 piercings down here at the bottom. Have there been any pain with them?
Nope.
No? All right, no signs of infection, inflammation, or anything like that. All right, I'm going to check your breath sounds back here. Just every time my stethoscope touches you again, can you take a breath?
Yep.
All right, you can breathe normal now. All right, no adventitious sounds on the back as well. I heard no crackling, no wheezing. Can you lean forward for me so I can check your spine? All right, spine is straight, no protruding vertebrae at all. All right, you can sit back up. AP diameter is 1 to 2, no barrel chesting. Let me know if you feel anything, all right? No. Oh, all right, CVA, there's no tenderness with that. Can you lay down for me? Right, let me put this pillow up for you. There you go. Now I'm gonna pull it in. All right. Abdomen is flat. No rounding at all. I see you have a few nevi on your abdomen. Have they been there your whole life?
Yep.
Yep. Have they changed in shape at all?
Yep.
All right, all of them are less than 1 millimeter in diameter. Borders are clear and round. They don't seem to be elevated. They're light brown. I see that you have a scar underneath your umbilicus. Can you tell me what that's from?
Previous piercing.
Previous piercing, right? No signs of infection there. There's a piercing on the top of the umbilicus. Is there any pain with that at all? No? All right, no signs of crusting or inflammation, no infection. All right, I am going to auscultate. sounds were present in all 4 quadrants. I am now going to percuss. Right lower point. Alright, I heard timpani in all 4 quadrants, but there will be dullness over the liver and the spleen, and sometimes in the left lower if there's fecal matter in the colon. Alright, I'm going to palpate now. Right lower quadrant is going to be the cecum and appendix. I'm going to look at the patient for signs of tenderness. Right upper quadrant is going to be the gallbladder and the liver. Left upper quadrant is going to be the stomach and the spleen. Left lower quadrant is going to be the sigmoid colon and the descending colon. Do you have any tenderness in any of those areas? All right, no signs of tenderness in the abdomen. Patient showed no tenderness as well. All right, I'm going to take this ball out and you sit up and down. All right, now I'm gonna have you sit up.
Muscle taking the 5 points. Perfect. No abnormal sounds heard. I'm going to go ahead and turn you to the side to auscultate your lungs. And when I ask, I'm going to ask for you to take a deep breath for me. Take a deep breath for me. Deep breath. Perfect. Lungs sound out clear, no abnormality. Now, Lisa, I'm going to go ahead and ask you to stand up. Stand here. And bend over to the front so I can check your back. Okay. The spine is straight, no abnormalities on the spine. Now we're going to go ahead and lean down so I can check your abdomen. In the abdomen, I'm going to go ahead and palpate. I'm first going to inspect for any abnormalities. No abnormalities noted, no stretch mark, no bruising. And I'm going to go ahead and auscultate, starting from my right lower quadrant. Bowel signs are within normal limits. Do you have any problems using the bathroom?
No.
Any pain?
No.
Okay. We're gonna inspect the genital area. No abnormal signs, no pain urinating or nothing like that?
No.
No? Okay, perfect. Thank you. Sit up. Now you're gonna
Palpate your carotid arteries. Okay. Carotids are at a +3. They're not bounding. They're just very strong. And I'm going to go ahead and palpate your lymph nodes. Okay. So preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, deep cervical, posterior cervical, supraclavicular, and infraclavicular. Alrighty. Unable to actually feel the lymph nodes, which is normal. They're not hard or swollen or anything like that. Alright, so back to the chest. I'm going to go ahead and listen to some breath sounds, okay? Alright, listening to bronchovesicular. Go ahead and breathe in. All right, breathe in. And breathe in. Breathe in. All right, and listening to vesicular up here. Breathe in. Breathe in. I'm gonna go under your tank top. Okay. Breathe in.
And breathe in. Alrighty. Breathe in. Breathe in. Breathe in. And breathe in. Okay. No abnormalities within the breath sounds. Go ahead and turn around, and we're going to do the same thing posterior wise. All right, just going to look at the skin and muscle structure here. Alrighty. All right, starting with bronchovesicular. Go ahead and breathe in. Breathe in. Breathe in. Breathe in. All right, moving on to vesicular. Breathe in. Breathe in. Breathe in. Breathe in. Going under the tank top. Breathe in. Okay. Breathe in. Breathe in. And breathe in. Alrighty. You can turn around now. Alright, all breath sounds were clear. There were no signs of crackles, wheezing, anything like that. Alright, moving on to the abdominal assessment. Have you had any changes within urination, appetite, or bowel movements? Any pain within the abdominal region?
No.
Okay, go ahead and lay back for me and lift your shirt. All right, just gonna inspect your skin here. Okay, I'm gonna go ahead and listen to your bowel sounds in all 4 quadrants, starting with the right lower. Alrighty, left upper. And left lower. All right, bowel sounds are normal active. No signs of abnormalities. I'm gonna go ahead and palpate now. So palpating the right lower abdominal quadrant and right upper, left upper, and left lower. Okay, good. No signs of tenderness or masses. Abdomen is flat. Skin is smooth, dry, and intact, and uniform in color. And was any of that painful for you?
No.
No. Okay, go ahead and sit up. And pull your shirt down.